Welcome back to the deep dive. You're listening because you want to get smart fast.
That's the goal.
And today, we're diving into something pretty heavy. The mental health impact of the recent conflict on Israelis.
Yeah, it's a critical topic right now. We've got quite a bit of data to sift through.
We do. We're looking at a report from several key Israeli bodies, Homefront Command-linked, Intel, Ministry of Economy via Zaman Israel, plus various surveys.
Right, quite comprehensive.
So our mission today is really to pull out the core insights, understand the sheer scope of this mental health challenge based on what these sources tell us.
And right off the bat, the scale is, well, it's quite startling. The headline figure, really, is this near 900% jump in people seeking clinical mental health care since the war started.
900% compared to before.
Exactly, compared to the period right before. And alongside that, a 100% rise, so a doubling in people looking for any kind of psychological support, be it individual, family, group therapy.
So it's not just the most severe cases, it's a broader wave.
It's a huge wave. It suggests the majority of citizens are feeling some level of distress.
Okay, so beyond just needing help, what specific problems are surfacing more? PTSD, anxiety?
Definitely those. Increased risk across the board. PTSD, anxiety, depression, even addiction issues are being flagged. Take the Natal Center, for instance. They deal with trauma from nationalistic violence.
Okay.
In the first few months, a 15-fold increase in referrals.
15 times. That's hard to fathom.
It is. Now, those initial numbers did decrease a bit later on, but they stayed incredibly high. We're talking about 43,000 contacts between the start of the war and June 2024.
Compared to what, normally?
Compared to just around 1,540 contacts for the entire year of 2022.
Wow. Okay. That really puts it in perspective. And other support lines?
Similar story. The IRN Association, they do emotional first aid, saw a 950% increase in calls specifically about anxiety, trauma, and loss.
950. Goodness.
Yeah. And also rises in calls about depression, general distress, loneliness, you name it. And the resilience centers. They took on 8,700 new individual therapy patients between the war start and April.
And before the war, what was their typical intake?
About 1,500 new patients every 6 months, so a massive jump. And the demand is apparently still growing.
So the formal help systems are clearly stretched. What about the general population's state, according to surveys?
Well, the surveys really back this up. One from the Maccabi Health Fund back in March found around 30% of Israelis felt their psychological state was medium or poor.
30%. That's nearly a third of the country feeling not okay.
Right. And there were gender differences, too. 55% of women reported a negative change versus 39% of men. Sleep quality also took a major hit.
Yeah, I saw that. Over half reported worse sleep.
62% of women, 38% men. And anxiety levels, way up. Over half reported some anxiety, which is a huge jump from about 11% pre-war. And nearly a quarter reported medium or severe anxiety.
It sounds like exhaustion is a big factor, too. I saw a figure about emotional exhaustion.
A huge one. Another survey, this one from multiple universities, found 75% of Israelis experiencing emotional exhaustion.
3/4 of the population.
Yeah. And surveys from earlier in the war, like November, showed nearly half reporting depression symptoms and less motivation right in those initial weeks. So the picture is consistently worrying.
Let's talk about specific groups. The reports mention children being particularly vulnerable. What are we seeing there?
It's deeply concerning. You have 83% witnessing distressing videos online. Around 300,000 kids have parents in the reserves, and most reported difficulties coping with that.
That's a huge number of families directly impacted by reserve duty.
Huge. And sadly, about 20,000 children are now officially recognized as victims of hostilities, mostly for psychological reasons. We're even seeing reports of increased smoking, alcohol, cannabis use among some teens.
And younger kids.
Studies show really high distress. One indicated about 76% of 2 to 12-year-olds showed severe emotional distress. Over half had anxiety symptoms. And parents. Around 72% reported high depression or anxiety levels in their children.
It affects the parents, too, surely.
Absolutely. Parents with kids under 18 showed much higher rates of PTSD symptoms, like 47% compared to just 12% for those without young children.
And then, of course, there are those on the absolute front lines, combatants, the displaced survivors.
Their situation is, as you expect, incredibly tough. People involved in the October 7th events, those fighting, they've experienced significant deterioration. They're seeking help at higher rates. Look at the Natal Center again. About 39% of their contacts since the war started were reserve soldiers. That's 10 times their proportion in the general population.
And the trauma isn't just about being attacked, is it? Combat itself.
Exactly. The act of killing someone, even an attacker in combat, is a known factor for developing PTSD. And Ministry of Defense data shows over 10,000 injured personnel receiving care by August, with about a third having psychological reactions.
And the survivors from the parties near the Gaza border?
The situation for those roughly 4,000 survivors from the Gaza envelope parties on October 7th is particularly difficult. They witnessed horrific things, lost loved ones, very high distress, severe PTSD, flashbacks, nightmares, depression, anxiety. Returning to any kind of normal life is a massive struggle.
Yeah, the report mentioned difficulty returning to work.
Huge difficulty. Only about 47% of those party survivors and only about 1/8 of reserve forces had managed to return to regular work. Many tried and couldn't, and it hits families hard too.
And the displaced populations from both the south and the north.
Significant impact there too. Around 34% of evacuated southern residents, even those who returned, showed PTSD symptoms, and about 28% of those evacuated from the north. It shows the impact isn't just confined to the immediate Gaza envelope.
Another thing flagged was substance use. A coping mechanism, I suppose, but a dangerous one.
Very dangerous. We're seeing reports of a 100% increase in addictive substance use, things like opioids, anti-anxiety meds, alcohol, tobacco, particularly noted in the Gaza envelope area, and more common among women and the elderly.
Opioids specifically.
A 70% increase in opioid consumption during the war. The estimate is maybe 200,000 Israelis now using excessively, risking addiction, even death.
And what does the health insurance data show?
It confirms it. Claylett, one of the big health funds, saw significant rises in sleeping pills, narcotic painkillers, antidepressants, anti-anxiety meds. In the first 6 months of the war, narcotic painkiller use jumped over 200% across health funds.
200%.
Yeah. And anti-anxiety drugs. Over 200% increase in the general population, according to one fund, and a 100% increase among the displaced people in the surrounding area.
There was a study focusing on women's use too, right?
Yes. Tel Aviv University found a 34% rise in sedative use among all women, but 42% among evacuated women. For those already seeking depression anxiety treatment, sedative use jumped 61%, and sleeping pills up 58% for all women, but a staggering 132% increase among evacuated women.
It just paints a picture of widespread, desperate need for coping mechanisms.
It really does. The stress and trauma are immense.
And presumably, the longer this goes on, the worse the psychological toll could get.
That's the major concern. Repeated, prolonged exposure to traumatic events is a key factor in developing PTSD. So yes, continued conflict will almost certainly deepen the psychological harm, especially for combatants, any remaining hostages, their families, the displaced.
So wrapping this up, this deep dive makes it crystal clear, doesn't it? The mental health fallout from this conflict is, well, it's vast, it's complex, it's hitting Israelis from all walks of life, and in really profound ways.
Absolutely. It's not just a footnote, it's a central consequence. The scale is surprising, even when you expect an impact.
It's definitely not a short-term blip.
No, the implications feel very long-term. And maybe the thought to leave you with is this. When you have such widespread psychological distress affecting so many people across society, how does that collective trauma ultimately reshape a nation's resilience, its social bonds, its future, really beyond just the individual level?
A sobering question indeed, something to really think about.